Hello, welcome to our channel. Today we're going to talk about fat in the liver. Did you know that fatty liver is becoming an increasingly common public health problem? What is fat in the liver? Hepatic steatosis? Imagine your liver as a sponge. When we are healthy, this sponge is clean and works perfectly. But when we eat a lot of fatty and unhealthy foods, this sponge starts to fill with fat. It's like you're putting oil on a sponge. Hepatic steatosis is the scientific name for this accumulation of fat in the liver. It's as if the liver is getting fat. This extra fat can disrupt liver function and cause several health problems. How does fat accumulate in the liver? Food, a diet rich in fats, especially saturated in trans fats and sugars, causes the body to have more fat than it needs. This extra fat ends up being stored in the liver. Other causes. In addition to diet, other conditions can contribute to the accumulation of fat in the liver, such as obesity. People who are overweight or obese are at greater risk of developing fatty liver. Diabetes. Diabetes deregulates blood sugar levels and can lead to the accumulation of fat in the liver. Excessive alcohol consumption. Alcohol is toxic to the liver and can cause inflammation and fat accumulation. Some medications can have the side effect of fat accumulation in the liver. It is important to remember that fatty liver, if left untreated, can develop into more serious problems such as cirrhosis. Therefore, it is essential to adopt healthy lifestyle habits, such as a balanced diet and regular physical activity, to prevent and treat this condition. 8 signs of fat in the liver. Understanding each one better. Fatty liver, or hepatic steatosis, can manifest itself in different ways, and symptoms can vary from person to person. Let's detail each of the 8 signs you mentioned. 1. Excessive tiredness. Why? The liver is responsible for several important functions in the body, including nutrient metabolism. When it is compromised by fat, there may be a decrease in energy production, leading to chronic tiredness. Other factors. It is important to remember that excessive tiredness can have several other causes, such as anemia, sleep problems, and stress. 2. Abdominal pain. Why? The accumulation of fat in the liver can cause swelling and inflammation, leading to pain, especially in the upper right region of the abdomen. Other causes. Abdominal pain can have several other causes, such as digestive problems, menstrual cramps, and appendicitis. 3. Loss of appetite. Why? Liver inflammation can affect the digestive system, causing nausea and loss of appetite. Furthermore, poor nutrient absorption can lead to a feeling of early satiety. 4. Nausea and vomiting. Why? As mentioned earlier, liver inflammation can irritate the stomach and cause nausea and vomiting. 5. Jaundice, yellowing of the skin and eyes. Why? Jaundice is a sign that liver function is severely compromised. It occurs when bilirubin, a bile pigment, accumulates in the blood and is deposited in the skin and eyes. When it occurs, jaundice is generally a sign of advanced liver disease and is not a common symptom in the early stages of fatty liver. 6. Itchy skin. Why? Severe itching is another sign that liver function is compromised. The accumulation of toxic substances in the blood can cause skin irritation. 7. Abdominal bloating. Why? Abdominal swelling can occur due to fluid retention or ascites, which is the accumulation of fluid in the abdominal cavity. When it occurs, abdominal bloating is a sign of advanced liver disease. 8. Pale stools. Why? Pale stools may indicate problems with the production of bile, which is essential for the digestion of fats. When the liver is diseased, bile production can be reduced, leading to pale, oily stools. It is important to note that not all individuals with fatty liver will experience all of these symptoms, and many may not experience any symptoms at all. The presence and intensity of symptoms vary depending on the extent of the disease and the individual's general health. If you are experiencing any of these symptoms, it is essential to see a doctor for a complete evaluation and accurate diagnosis. Treating fatty liver involves lifestyle changes, such as adopting a healthy diet and practicing regular physical activity, in addition to other treatments that may be recommended by your doctor. Remember, the information provided here is for educational purposes and does not replace medical consultation. Did you like the video? Want more tips to take care of your health? Subscribe to the channel and activate the bell so you don't miss any content.